I love the day-to-day nature of my job. I love the variety, but I also love the patients I encounter.
I think it's a fantastic hospital. It's got a really good feel to it. It's got great team environment.
I think that one of the nice aspects of the hospital here is that it's generally a friendly environment.
Northern Hospital has been around 11 years, which may not seem long, but in that time, in fact, it's probably grown to 3 times its size. And as a result of that, we are able to offer our Northern Health residents a very broad experience in not only the core units, but in several of the subspecialties.
I guess we've got a very strong focus on general medicine and general surgery. We also have a very strong aged care component, and we've got lots of unusual programs that support that.
We do have a lot to offer here. We do have your allied health staff, so you have your physiotherapists, you have your speech pathologists, your hand therapists. A lot of the medical specialties as well, respiratory, renal, gynecology.
It's also a very busy obstetric unit, so we deliver well over 2,000 babies a year, and that number is increasing every year, so it's always a busy day on labour ward.
I think the best thing is the teams that we get to work in. They've just been amazing, you know, so you've got questions, they answer them, they help you, they guide you through it, they teach you at the same time, and then you transfer to another team and you get the same response. So everywhere you are, you're getting helped by your team.
You've got clerks, you've got nurses, you've got consultants, registrars, residents. Everyone's friendly, which is really good. And also, you know, you don't know everything when you start as an intern, and nobody has any issue with you saying, I don't know what to do, not quite sure what the next step is. Someone will always help you through it. Being at the Northern, the patient base is like doing multicultural medicine in Australia, and it really is. You get a huge diversity of backgrounds, you get non-English speaking people from a variety of places, you get people from all different socio-economic levels, and it gives you a real chance to learn communication skills and medical skills at all different levels. It's challenging, but it's challenging in a good way.
The Northern Hospital in particular, one of the best things about it is that because it's not too big to be overwhelming, that you actually get to see a lot of the presentations that come through.
You get to see the patient come in, you get to do that initial assessment, you get to work them up, so that chance to really be a doctor and do it from go to woe is fantastic.
Things that brought me to work at Northern, I think, is that the size of the hospital is actually very easy to negotiate. It allows the staff actually to get on well, get to know each other, and therefore we can all work together quite well.
What I have seen here is that I walk down the corridor and I know the nurse's name walking the other way, I know the allied health staff, I know the cleaner's name, I know everyone. I'm not sure I'd feel the same way in a much larger hospital.
I think you can see that this hospital is going to become an even bigger hospital and more important hospital to the city. So this being a massive growth corridor for the city, it's going to have to grow to accommodate the patient needs of the population, which means lots of jobs for new consultants who are graduating from their specialty training into the future. And it's only going to get a better hospital the more great people that we can attract here.